the two presenters, and I will pass it over to you. I'm going to spotlight Sarah. And then spotlight Penny. And then I will share your slides if you're ready to go.
Brilliant. Shall we get going now, do you think?
That sounds good, yeah.
Okay, brilliant. Thanks ever so much, everyone, for coming along this morning, this afternoon. I don't know what you say when it's 12 o'clock, but thank you for coming. I really hope that this is going to be useful for you. I'm Sarah Gorin, and this is Penny Smith on the call as well. Penny, do you want to say a quick hello?
Hello, I'm working alongside Sarah at Warwick in the business school.
And we're both from Warwick University, so we work alongside Amy Grove, who was talking this morning. And Amy's work is on systematic review. She's sort of one part of this Warwick partnership, and we are doing primary research. So we're this sort of primary research arm, myself and Penny and Graham Curry, who is the professor in the business school. So we're researchers. We're part of the RISE partnership as well. So that's the Research and Improvement in SEND Excellence partnership. And that's between Warwick University, the Council for Disabled Children, the National Development Team for Inclusion, and the ISOS partnership. And we are really fortunate, very fortunate position to be in. We are being funded for 3 years by the DfE to do primary research on aspects of SEND service improvement. And we're here to talk to you today about the first deliverable that we were asked to do in the first 6 months of our funding from DfE. DfE. I call it DfE. I'm getting confused with my sons doing the DfE. Yeah. Sorry about that. Yeah, so today we're going to present some of the key findings from this first deliverable, which was looking at the lessons from the Delivering Better Outcomes Together programme. And what we wanted to do there was to try to understand the experiences of those that had experienced this intervention, but also to find out from them what were the really key ingredients for SEND service improvement in their local area. Okay, so what I think it's important to say is that we're going to talk for about 15-20 minutes to you, and then what we would like to do is to hear from you guys as well, so that you can tell us about whether what you've heard resonates with your experiences, what's happened in your local area around improvement in SEND, you know, what are the difficulties, what are the things that have helped your area improve, if that's the case. So we'll be having some discussion around that. So it's a kind of 15-20 minute presentation, and then kind of 15-20 minutes when it's over to you to tell us a little bit about, you know, your experiences as well. And hopefully we'll have a good conversation about that. That will be useful for everyone. So just to say, first of all, we're going to kind of whiz through this presentation. We always do more than the time we're allowed. So there are probably some slides that I won't be able to talk to in great depth, but you can have a copy of the presentation. There are also reports that go with this. So like with Amy's, there's been a report from Amy's first deliverable. There are 2 reports that have come out of this, one full report and a summary report, and those are kind of been sort of put into a little bit of a more kind of user-friendly version, I suppose, to go on the What Works in SEND website. But I did think that if anyone would like to have the copy of the reports as they are, then, you know, we're more than happy to send them out to you now. So what you could do maybe is put your email down in the chat if you wanted to receive a copy of those, and we could send them to you afterwards. Okay, brilliant. Okay, great. Can I have the next slide, please, Cara? That would be lovely. Okay, so let's tell you a little bit about what we did here. I said the aim of the research was to talk to professionals with experience of receiving the intervention called the delivering better outcomes together, the DBOT intervention, and what they saw as those really key ingredients around improving services for children and young people. Okay, so for anyone who doesn't know, the Delivering Better Outcomes Together programme, or the DBOT programme, was a programme of support to local areas to help them understand their SEND responsibilities better. So it started in 2014 and it ran for about 8 years. And the idea was to try to support local areas to understand those responsibilities better that were embedded within the legislation. And things that would be done were sort of workshops on things like areas like leadership, co-production with children and parent carers, how the local area could improve their collection of and use of data and things like that. So CDC, NDTI would bring together people within a local area and try to really move on their thinking and help them to think around those issues and come up with some kind of plan for improvement. So that's what the DBOT programme was. What we did was go in and talk to people within 7 different local areas. We talked to 24 people across 7 different local areas. Now, when we set out to do this research, what we were really keen to do was to talk to some areas who'd had the DBOT intervention and had then really managed to improve. So they'd really taken on this learning and they'd been able to run with it. And we wanted to talk to some who had experienced the intervention, the DBOT intervention, but then hadn't improved, hadn't been able to take on the learning for whatever reason. So we spoke to 24, as I say, SEND leaders, managers and practitioners, and we also talked to policymakers and senior stakeholders who were responsible for commissioning and implementing DBOT. And we talked to people across a range of agencies. So there were people from education, there were people from social care, and there were people from early help and health as well. And I think, they were generally very, very experienced in SEND and were able to tell us a great deal about what they thought had really helped or hindered improvement in their area. Okay, Cara, can I have the next slide? That's brilliant. Okay, thank you very much. So when we went out when we were talking to the local areas, the 7 local areas, we asked them, what was helpful for you in receiving the DBOT intervention? And they said that the bespoke nature was really important. So the fact that it wasn't a one-size-fits-all solution, it was called, I think, the antithesis to consultancy. What people said was that, that was really important to them. They were very agile and they were very able to respond to what the need in the local area was and develop training and support in relation to that. And we asked them, we looked at the factors that influenced whether they were ready to take on change in local areas, because obviously at the time, some of them had had the intervention, some of them had just had a written statement of action, and others, maybe had just decided that they were struggling with some aspect of their service and they wanted to have that support from the DBOT intervention. And what we found was that actually the timeliness of DBOT was really important. So if people had just had a written statement of action, they tended to be very motivated at that point in time. They really wanted to make that change. They were ready for that improvement, but also that leadership had accepted, hang on a minute, we're not doing things right here, something's gone wrong. Leadership had prioritised SEND a little bit more. and perhaps had allowed the resources for people to attend this training, and had made time a little bit more for that improvement to happen. So the timeliness of the intervention was really important, and it being at the right time in the local area. If they received it at a time, for example, when there were difficulties within children's social care, and the focus was more on what was happening in children's social care, sometimes that meant that they weren't really in the right place to take on that change. We also found that having a pre-existing values-based culture was important. So if they were already there in terms of a kind of a partnership way of thinking, of having those strong values and that culture of having the child as the kind of key consistent focus, if they were already there with that work across the partnership, then that made quite a difference in terms of whether they were ready for change. And there was often a lot of will to make change and to make improvement, but often sometimes there were challenges, particularly around funding, around budgets, that meant even if they wanted to work in a needs-led way, sometimes what could happen was that it went back to being resource-led. So sometimes it was difficult to actually sustain any progress. So even if they had that kind of motivation to make change, sometimes that could be impeded by things like funding and a kind of loss of momentum at times, because it takes long times in large, I'm sure you all know, in large organizations like health, like social care, like education, to get things through. So sometimes that momentum could be lost. Okay, could we have the next slide, please? Brilliant. Okay, so what we really wanted to know was, in the areas where DBOT learning had been taken on and improvements have been made in the local area, what had really made that difference for people? What were those really key ingredients for service improvement and for sustaining that service improvement? And these were the 5 things that people really talked to us a great deal about. They talked about the importance, as we've heard this morning, and everyone probably already knows, that importance of co-production, but sometimes the difficulties that can be associated with trying to get really good partnership going with parent carers and children and young people, and the pressures on them to take part. Also about co-production with agency partners, about leadership, about workforce capability, stability and morale, and about organisational culture, and that having that accountability across all partners. So these were our kind of 5 key factors. Now, in an ideal world, we'd talk to all of them, but unfortunately, we haven't got time today. So we're going to kind of whiz through them, and some we'll talk about in a little bit more depth than others. Could I have the next slide, Cara, please? Okay, so in terms of co-production with children and young people, people talk to us about finding that should be, knowing that should be really, really central, that should be at a strategic as well as an operational level, and that it should be more than just your kind of box ticking exercises. But the reality in areas was that was difficult at times. There were lots of demands on children and on parent carers, and sometimes it could be the same parents, meaning that there was even more demand on their time. And also it was difficult then to ensure that there was diversity across that kind of parent carer forum. Excuse me, sorry, so that you didn't have the same parent carers all the time involved, and that you were able to draw in parent carers and children and young people who maybe had poor experiences and hadn't engaged previously. So there were a lot of challenges around that. Could I have the next slide, please, Cara? Okay, in terms of co-production, and Amy touched on this earlier in her talk, the thing that made DBOT really valuable for people was that it made space for people to come together. And so that was what people talked to us a great deal about probably, you know, working within their own agency a lot of the time and not having those opportunities to get together, to really spend that time thinking about their kind of developing a kind of common language. So there were people that talked to us about, you know, the use of different languages for different things across the different agencies, and that in meetings sometimes, you know, it took a while to work out, you know, well, you're talking about the same thing that I'm talking about, we just use different words for it. So people found that the DBOT interventions were really fantastic in terms of having that sort of coming together, that agency coming together, to be able to talk about, you know, differences in languages, differences in cultures across health and social care and education, and trying to find a way forward in that. Sometimes the work would be to develop a shared vision, and that was really useful to people, because they were able to talk about, well, you know, what are we doing? What should we be doing? And at times challenging other people's cultures. Okay, can I move on, Cara? I'm taking a bit too long on this, I think. Great. Leadership I won't talk to you about, other than to say that it was really, really important, particularly to get the leadership right at a chief executive of the council and a political member level, to make sure that they knew about SEND and that they were prioritising SEND at the highest levels. And I'm going to pass on to Penny now, who's going to whiz us through the kind of second part of the presentation so that we've got plenty of time left.
Okay, brilliant. Could I have the next slide, please, Cara? Okay, so one key ingredients for DBOT to really land in local areas was, of course, workforce. And that's something that's going to be no surprise, that this was sometimes a barrier to things kind of being embedded, for improvements to embed. And there's a list of the challenges here. A key thing was the agency use in local areas, and particularly in the SEND system, which made kind of things difficult for parents kind of to engage with different staff retelling their stories. We also found that COVID had disrupted the workforce to an extent, because obviously we were looking back at people's experiences of DBOT, and DBOT ran between 2014 and 2022. So that kind of COVID sat in the middle of that, and that had caused a lot of disruption to the workforce. But we found that when local areas had positions like designated DISCOs, designated social care officers, they could be the conduit to really bring kind of partners together, and that really helped. And DBOT were able to really focus on those issues in the workforce. The leadership programme was something that was really valued. But also when local authorities were able to focus on the professional development of their SEND teams, that was really important, because often those teams were facing a lot of the pressure and a lot of the accountability as well. So it was really the workforce capability and morale was a real kind of ingredient for improvement we found in local areas. So if I could just have the next slide, please, that'd be great. Thank you, Cara. Okay, well, organisational culture, this was really important. It was a real obvious key ingredient, and was often the impetus with the other ingredients. So, you know, you wouldn't get the organisational culture without a decent leadership that was on board for that culture of change. Some local areas referred to achieving or working towards a value-based culture, and that was very much in alignment with the values instilled by DBOT. And then if there was that in alignment, then impact was more likely to happen. That's the focus on the whole child, strengths-based approach, and this is the antithesis to a risk-averse blame culture and a lack of trust, which inhibited change in local areas. The fact whether they'd got they recently had a written statement of action could actually mean that they had the impetus to really kind of be catalysed towards change, but sometimes that could be a barrier if, you know, they felt overburdened. On Ideally, values-driven work would be backed up with a robust and consistent evidence, and that was key. But there were inconsistencies across different areas, with the extent that they got that in place. And of course, co-production was really important. Co-production with different agencies, but also with children and young people, to ensure that there was that kind of trust to mitigate that risk averse and those blame cultures. The next slide, please. Okay, I'm going to skip over this a little, but obviously accountability was something that was really important. This focus of responsibility, accountability for SEND tended to land on SEND teams in local authorities, and that could be problematic, as SEND is obviously a partnership. And when we did the research, one of the key issues in terms of accountability was health. There weren't always health partners at the table, and this was kind of a real problem. Again, those cross-agency roles, designated health officer, designated social care officer, could really enhance accountabilities in partnerships, and that was a real ingredient of drawing people together to get that kind of buy-in. And also the emergence of the ICBs. When we were interviewing, it's nearly a year ago we started this, but ICBs were at the very early stages, but they were starting to make a difference. But they had kind of complexed the space in terms of kind of drawing together people. So, okay, if we could have a look at the next slide, please. Okay, so this summarises what we believed were the key conditions for DBOT to start to land in local areas. As I've said, organisational culture was incredibly important, a strength-based approach, a learning culture, a prioritisation of SEND to mobilise resources and get it onto agendas was very important. Timing was key too. So as I've said, if the local areas had had a written statement of action, this could be an impetus for change, and they would welcome DBOT with open arms, and but also they might feel overburdened. So it really depended on the way that local areas were inclined in whether they were ready to receive that, that input. Strong leadership was really important, and that the stability of that leadership was important too. If you had a clear lead from those at the top of local authorities, those senior leaders that would say, this is important, we need to do this improvement work, let's work together, that made a real difference. That was critical to driving the agenda, as was meaningful co-production across parties, across partners, particularly with children, people and families, and also the effective measurement of success. The next slide, please. Okay, I'm just going to skate over this a little because I know that we're really pushed for time, but just to say that DBOT was really valued for its bespoke nature, the quality of the programme in terms of knowledge and network development, but also receptiveness in local area, and the ability to sustain improvement was dependent on a number of variables and contexts, as we've discussed. But hopefully we've highlighted some of these ingredients needed for SEND service improvement. And if we quickly have a quick look at the recommendations. Now, sorry, the next slide, please. So this is quite a dense slide, so I won't go into it, but just wanted to really highlight something that Christine mentioned, which was partnership work, and setting the time aside to do the partnership work. And that's something that really came through in the research that we did, and that's about creating a culture and giving people the time and the space to do that really deep multi-agency work of understanding collectively what we mean by SEND, what we mean by inclusion, and having those conversations. And I think that's something that across the partnerships and across the interviews that we did was something that people felt frustrated by, but that DBOT allowed. So there was that meaningful time and space for developing those SEND strategies. And this is something kind of that we'd really like to explore further, that kind of partnership work and what needs to be done to go forward. There's also some practical advice that we had, which was in terms of the sort of programmes that would be useful in local areas. DBOT was short term, and sometimes it was felt that they weren't sustainable enough, so that old habits kind of work kind of got back into once DBOT went. They wanted something where they were checked in on regularly, because the will was there, but then there was a balance between firefighting and doing that deeper work. Okay, so could I have the next slide, please? Okay, so basically then it's over to you. We're really interested to know what you think about what we found, whether it's resonated with the work that you're doing, your experiences, whether there's some things that surprise you, or if there's anything you feel we haven't missed. Of course, this is part of our longer report that we wrote. We've also got a short report as well, and we can distribute both or either of those to you, and also these slides. So Sarah, over to you.
Okay, yeah, I mean, we've kind of put these questions up here to try to generate a discussion, but I've noticed that Chris has put something in the chat around accountabilities, so I'll respond to that in a minute. But if anyone has any thoughts about what we've said around our findings, whether they resonate with your experiences in your local area, maybe you can put your hand up in the chat and we'll come to you in a moment. But first of all, just to say to Chris, thank you for your question. It was around kind of SEND accountabilities landing on local authority SEND staff, and that kind of very familiar message around that. And the question was, what examples were there from DBOT of effective shared accountabilities, including schools and maths? I don't know whether anything comes to mind to you, Penny. I mean, we did hear about people working together better because they'd had these workshops, because they'd done DBOT, they developed those kind of relationships, which meant that even though it was informal, people felt that accountability more. They didn't, they started to build relationships. So I'm thinking particularly of a designated clinical officer that I spoke to who had the NDTI training on leadership when he'd first come into post. And he said it was really useful for him because he then joined up with people in the local authority. He made those relationships. He's obviously spent a few days, probably had a few nice lunches, and managed to kind of, form relationships. But then that kind of that relationship continued, and they managed to kind of talk more about priorities. And even though we know that the accountability tends to come back to the local authority, it shouldn't be that way. But I think if those relationships are built and that kind of shared understanding is built, then we found that people were more, more invested in helping, perhaps. I don't know, Penny, what do you think?
I was just going to say that the issue with the academy's structures, the maths, was definitely a barrier to getting the whole education system to buy into inclusion. At times that was discussed, and it did rely on leaders in schools being on board, so buying into the inclusion ethos of the local area. And they did, as a result of DBOT, I think they did develop particular kind of strategies and documents that encourage that broad buy into inclusion and genders. But it was kind of a work in progress, and the mix of schools in local areas, so academies and some areas, grammar schools as well, weren't necessarily on the same page, and it was a work in progress. But that kind of multi-agency work that DBOT encouraged, so bringing people into the same room to talk about, well, what do we mean by inclusion? What do we mean by the graduated approach? All those sort of conversations were encouraged by DBOT. The issue was embedding that. So yeah, that's what I think came through with education.
Yeah. Chris, did you want to come back about that?
Yeah, just quickly, if that's all right.
Yeah, of course.
Were there any examples of SEND boards that made some progress? Because in some ways, in terms of accountabilities, it's from the top. And sometimes there's that challenge of a board feeling a little bit remote from developments and impacts in, I suppose, EHCP processes, children and young people's lives, services joining up. I don't know, were there any examples from boards that made some inroads around the accountability, shared accountabilities area?
I can't recall very specific examples, to be honest. Can you, Sarah? Sarah?
We've frozen her into silence.
She's frozen. I don't think, I personally, I can't recall any specific examples on boards, but I would have to go back to the report to see if because it's been a while, to be honest, since we wrote this, but we're more than happy to share that with you to see, you know, to kind of get into the nitty gritty of the detail with that.
Okay, I know that's specific, but I'm just sort of thinking because boards are increasing, well, in terms of local improvement plans, etc. That's the accountability structures that are being promoted in the Send an Improvement Plan. That was fine. But yeah, thank you.
Okay, were there any other questions or comments or anything that resonates with people's experiences at all? Oh, hi, Stephen. Hi, Stephen, did you want to comment?
Sorry, I was talking away and just muted there. Yes, good
Okay.
afternoon.
Oh.
Yeah, I think for me, I think the leadership is a very interesting point, and a comment Alistair made this morning around that one of the main drivers are where you have staff that are passionate, things go well, and then when that staff member leaves or that leader leaves, things just disappear. I was wondering whether that was mirrored. That's certainly my experience. I was wondering whether that was mirrored in your research, and whether there was any sort of indicators as to how we break that cycle.
It absolutely did come through in that particular individuals became the champions for particular types of work. So people we interviewed would say, you know, this was driven through by this very passionate person or this passionate group of people. And I suppose underlying that is a culture, and challenging the culture was, because the hello, welcome back, was really what was needed. So when that person moved on, there was effective succession, so that culture was kind of instilled. But beyond that, it had to be leadership that kind of was kind of ran throughout so distributed leadership throughout the organisation, and doing that kind of joint work across the partnership, across the agencies, to ensure that those values were instilled broadly. So yes, it was a problem, but also we found that when fresh leadership came into organisations, that could be a real plus, so that they would bring in a drive, and they'd have a fresh approach to the local area and the local area partnership, and perhaps see issues and barriers that hadn't been recognised because there was such embedded kind of dysfunction in some cases, or just set ways of working. So really it was a mixed bag, but definitely the message about passion being kind of imbued in one particular or a team of people was definitely there. It's something that we found, and it's about challenging cultures and embedding ways of thinking across organisations. I think the question, Sarah, was about whether we found that with particular leaders having particular passion for Send and driving change when they left, how that impacted, and whether we found that to be an issue. I was just saying it definitely was. But the only way the way of tackling that was looking at the culture and looking how to kind of embed that into local areas across partnerships.
Yeah, I think, I mean, leadership is so hugely important. And I think, you know, we found that when we did this research, and now we've moved on to do some more research, and we're doing 2 different deliverables now, one of which is looking at DFE intervention in areas where there are significant weaknesses. So where they've had you know, an improvement notice or sort of more DFE intervention, and leadership has really come through as being the key thing that needs to be right. And there are issues in getting that right at times, obviously. So leadership was very much a kind of a really key important thing to have right, but at a few different levels as well. And, you know, we found that at times, you know, there's also such a change in the workforce that you know, really doesn't help at times. It destabilizes the local area when the leadership changes or when there's interims in place. And so, you know, we did find that in areas where that leadership had been more stable, you know, they were really able to take on learning better and build upon that learning and stay kind of with the same direction and the same focus. So yeah, I mean, I think that was definitely an issue, and certainly in what we've been doing recently has been around kind of, you know, we found that there's a real lack of understanding of SEND, a real detailed expertise in amongst leadership as well, and that is a real issue, particularly amongst sort of chief execs. And
I could just quickly say, so somebody just asked a question about partnership boards, and I apologise for this. These are really important, obviously, in local areas. My head is in a different kind of, or do some writing on something different, a different partnership boards at the moment. So I apologise. In DBOT, they really encouraged local areas to strengthen their partnership boards and to ensure that it had a more widespread accountabilities across agencies on them. And that was absolutely crucial, just to kind of emphasise that. To get those voices and accountabilities instilled. But again, there were issues in certain individuals, certain parts of the system being present or being available, and that was health, which was kind of something that we heard quite a bit, wasn't it, Sarah? The lack of engagement with health. But sorry, just a quick confusion about partnership boards and mixing things up in my head.
I wonder whether there's anything that, sorry, Cara.
Just to say there's 2 minutes left.
Oh,
so
okay.
of this session. Coming to the end.
Okay, not very long then. I don't know if anyone else has got any other questions that they would like to ask us or comment on, you know, go. Would anyone else like to say? No, doesn't. Okay, well, we will send you the reports and please get in touch with us if there's anything that you would like to discuss beyond here.
Sarah's you've frozen again, but just to thank everybody for coming, and we are happy to, the slides will be shared and we're happy to share the report too.
Thank you very much. I did drop a comment in the chat around interested in like the voice of children and young people, and as aside from that, parents and carers as well. Is that sort of information within the report as to?
Yes.
Yeah, great. Okay.
It's more in depth. There's a chapter on co-production specifically in the report, so we can share that with you, of course.
Perfect. Thanks very much.
Okay.
Fantastic.
Thank you.
Thank you, Penny and Sarah, for that great presentation. Really interesting stuff. So I think there's a 10-minute break now before the next session. So if everyone wants to leave this call and then rejoin the next session that you're attending at 10 to 1. Thank you.